Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome Trevor Cabrera, pediatrician and soon-to-be neonatologist. Today's Kevin MD article is Locum Tenens, Reclaiming Purpose, Autonomy, and Financial Freedom in Medicine. Trevor, welcome to the show.
Thank you so much, Kevin. It is an honor to finally have a chance to talk to you.
All right, so let's start by briefly sharing your story and then jump right into the article and why you decided to write it.
Yeah, so my story, originally I'm from California. I did a lot of my training in the South, did med school in New Orleans. I did my pediatric residency training at Houston at UT Houston. And during my second year of residency or so, I had been introduced to the idea of locum tenens, which I think had become more and more popular. And with COVID, people started to hear a lot more about these things. I finished my residency in 2020, and I had thought about for a while going back to fellowship to subspecialize, but wanted a little bit more experience and wanted to really, frankly, throw myself into the fire in some of the scenarios that I would face as a pediatrician and hopefully neonatologist, and ended up starting with locum tenens. And during that time, the plan had been to do locums for a year. I ended up doing it for 3 years full time to the extent that I actually renamed myself the nomadic pediatrician. I've got a blog for that too that has some of those journeys. And when I say that, I mean that I lived entirely out of a suitcase for 2.5 years. There was one year that I traveled and did locums for 359 days. And so I've known a lot of people that have done locums. I don't know how many have really taken it on that significantly, but during that time period, 2020 to 2023, I worked in 15 hospitals in 10 different states. And then as we hit 2023, I realized I was getting a little bit older, getting a little bit more tired, and this was the time to reconsider fellowship. And so in 2023, I restarted my fellowship in neonatal perinatal medicine or neonatology at Children's Mercy in Kansas City, Missouri. And that's currently where I'm at. And I will be graduating this upcoming July 2026 with plans to go back in the locum tenens, which was some of the things that sparked me contributing this article to Kevin MD. I really loved my experience, and I know a lot of people have written about it on your site, but I think that there's been a really growing trend towards a generational change in who's deciding to do it. And so part of why I have taken such an interest in discussing it, bringing it to the surface and bringing it to mainstream is there's a lot of trainees that have started to ask me about locum tenens.
Mhm.
It's no longer just a mid-career or retiring physician. And so that's kind of what led to this article.
So you mentioned that the concept of locum tenens was introduced to you while you're in training. What specifically about locum tenens appealed to you that early in your career?
I think when I had first heard about it, and granted, I'd heard about it by an agency, so there was a little bit of bias. One thing that was stressed was the ability to have the flexibility in a schedule, the autonomy of choice on what you're doing, that kind of freedom. And of course, a big part for me was also the income. Now, when I started doing locums, for me, my thought had been, well, these are short-term contracts. They're really, I'm a substitute going to XYZ hospital in the middle of nowhere. And it was a personal journey that I realized if I went from somewhere with all of the resources in Houston to somewhere with less resources, it would kind of force me to grow in ways I hadn't thought about before. And the other thing is that the compensation sounded great, and as I dove into it more, I learned it could be very lucrative, and really it made sense because I was going places nobody wanted to go. So those were the things that really stood out to me and why I thought about doing it. The other thing was I wasn't 100% sure on which fellowship I wanted to go back for. And so this gave me some time to work without very stringent commitments, and I could make the choice to go back to training or change my life at any other point.
So at that time, what other options were available to you? I could imagine you had locums, and then you just had other traditional pediatric jobs, whether in a clinic or a hospital, some type of W-2 job. Is that correct?
Correct. The biggest thing that changed, and this may not apply to everyone, but in 2019, the American Academy of Pediatrics and the American Board of Pediatrics changed our training. And they started to really want to mandate that anyone wanting to be a hospitalist had to do a pediatric hospital medicine fellowship. And so when I graduated residency in 2020, I was the first year that was not able to grandfather into that without the fellowship. And so for me, the options were really actually clinic, outpatient, or fellowship. And within the realm of fellowship, I had thought about pediatric intensive care, neonatal intensive care, or doing the pediatric hospital fellowship. And so that is kind of where I was stuck, frankly.
So tell us the main messages that you want readers to come away with from your article on Kevin MD.
The main messages that I want people to come away from, I think a lot of people are starting to learn about what locum tenens are. And so that's no longer really the main question. And when I peruse Kevin MD, I've also seen that there's a lot of articles on locum tenens, a lot of people discussing the pros and benefits, and a lot of things having to do with the costs or the savings or a lot of things financially. The purpose of my article is really to reinforce that outside of some of the connotations that locum tenens has for these substitute workers and the fact that there's a lot of money in it, there's a lot of good that can come from it. There's a lot of a large effect that can happen in communities that make ripples way farther than we believe. And it doesn't matter what specialty you are. I have met surgeons, I've met internal medicine, adult physicians, and I've met people that do pediatrics that have done locum tenens. And what you see is a lot of them enjoy the freedom of choice for their schedule. They enjoy that autonomy of being able to really choose what they want to do and how much they're going to do it for, or if they don't want to do it. But on top of that, there is a large effect that brings you back to the focus of medicine on how you can affect large communities. And, for me, I think at the time too, there was a big part that obviously finances was a big deal. I was able to pay off all of my med school loans in 3 years, and I think that that is a harder thing to be said of some of the lower paying specialties. So the overall takeaway for me is that anybody can do locum tenens, and for every reason that people hesitate on it, I can give you a reason that I would actually advocate for it. Whether you're at the beginning of the career, whether you're mid-career or later in life in a career, or you want to do it on the side of what you're currently doing, I think that it has brought more fulfillment to my life and has also lessened a lot of the burnout that we face.
So you mentioned that you were able to pay off your medical student loans in 3 years. So the income that you get from pretty much full-time locum tenens, you mentioned that you did it pretty much every day for a year, substantially more compensation than a typical pediatrician W-2 job. Is that correct?
That's correct. And I would say that most people doing locum tenens, and I still advise this anytime I have a trainee or actually a co-attending that comes up to me asking, you should expect at least about 20 to 30% of a salary that's higher than the average market for your specialty. And it can vary drastically, but that is the bare minimum of an increase to expect. And another thing you bring up, which is the point on the W-2 versus the 1099. And I think that this is something that is extremely lucrative, is to really understand that being an independent contractor has incredibly vast savings differences. There were some of those things I didn't really quite know about, and I think I had referenced one of the resources I'd used and looking these things up. There was a Comp Health or CHG healthcare guide, physician's guide to working as an independent contractor, which kind of gave me some advice in this regard. But there are times where when you're looking at retirement, if you have a standard W-2 job, sure, let's say you can put 20,000 into your 401k. Well, my solo independent retirement, my IRA, my SEP IRA, my maximum contribution was something like 60,000 or up to 25% of my overall salary. And so when you think about that in the very, very long term, not only are you making more per hour, you also are able to invest more per year. And on top of that, the tax deductions that you are able to figure out are actually very savvy.
And then what about things like benefits, like malpractice, health insurance, now that you're kind of a more of a contracted employee during those locum tenens years?
About the benefits?
Yeah.
Well, that's one thing that I would say that, on the positive side, what I enjoyed about working with an agency, or what I do enjoy about it, is there's really no concern for me from a malpractice coverage standpoint. They always carry the liability for you.
Mhm.
And I'm sure that direct contracts with hospitals, which I have done one or two, also can work in to have liability as part of what they cover for you. As far as the other benefits, yeah, it is true that you are going to pay for those own benefits, but I pay for my own health insurance, and I pay for my own disability. But realistically, when you think about the increase in the salary for the job, it really kind of levels out. And that's what I think is That's a really important thing I think I stress to people. Overall, we are all trained to follow the same mantra that everyone before us has done. We are trained just to go through these steps and to not question things that sound uncomfortable and different. And the reality is, everyone says to me, wait a second, well, they're not going to cover your health insurance. And I said, yes, that's true, but I'm making so much more money that me paying for private health insurance out of pocket is actually really a good deal.
Now, you mentioned that you were in some pretty remote places for your locum tenens placements. Give us an example of, say, something that you would find out was a good fit for you and somewhere that perhaps was a less good fit for you. Just give us an idea of the spectrum of places that you've worked at.
Sure. And this is something that will vary depending on specialty and the need. But as a pediatrician that was open to doing different types of care within that clinical scope, I was able to go a lot of places. I would say, some of my biggest impacts, I was in Deming, New Mexico, which was a small town about 45 minutes north of the border. We'd have a lot of patients that would actually come to the border in Mexico. They would come to the border in labor and they would be transported to our hospital to deliver. And I know a lot of people have different thoughts on that, but for them in Mexico, we were actually the closest hospital, being about 45 minutes, an hour from their border town, versus another hospital in Mexico that might have been 2 hours away. And so I had patients that would come up from there. It was in the middle of the desert. I worked in a small town called Bridgeton, Maine, or called Bridgeton in Maine, and there was only about 5,000 people that lived in that town. And I also got to work in Bismarck, North Dakota, where I got to work with a lot of the tribes that had come into that area as well. Those were some places that were a little bit more rural. I actually liked them because the way that I actually went into these jobs and went into these situations was with an open mind to experience and really just really immerse myself in those kind of situations. But on top of that, outside of those jobs, I worked at a major medical center, which was Tufts Medical Center in Boston, Massachusetts. I worked with a Mayo Clinic out in the Midwest, some places that were pretty significant and as far as their popularity and people know about these names, and they were in some more urban areas. So I worked in urban and rural. I worked in mostly inpatient, and then within inpatient, I worked with newborns or I worked with older kids, full actual pediatrics. And then there was some times where I did work and have a little bit of clinic as well. So for me, finding what was a good place, there was a multitude of factors, and what I ultimately found was I didn't like some of the places that were a little bit smaller, and then there was some that were in the medium size that really fit me. There was some that were in colder areas that I liked more than hot areas, and then I also found that a lot of the people that I tended to really fit in with were in New England, which I never would have experienced and I never would have thought about had I not done locum tenens, just because all of my experience, all of my training prior to that had been the South.
And just want to emphasize that point. Locum tenens doesn't necessarily only mean remote places. Like you said, you work at Tufts and a Mayo Clinic, as well as urban settings as well. So again, there's a spectrum of settings that locum tenens can be placed in.
Right. And I think that is another large takeaway. Everybody sees my life, especially when I call myself the nomadic pediatrician, and they think, okay, you need to travel. That's not true. And I can tell you where I'm currently based out of for different specialties, there's more than one job within less than an hour or two from where I'm at. And that kind of helps out. And also in big cities, people that want to be a little bit more urban or can't travel because of family or responsibilities, there are options to do that.
Let's talk about locum tenens companies. As you know, there's some variability, and I've read a lot of variability in terms of how good they are, how reliable they are. Tell us some things that physicians should look for when working with a locum tenens company and some red flags.
Absolutely. I love this question. So, just like there's going to be a good physician and a bad physician, no matter where you're at, or a good or bad hospital, it's the same with locum agencies. In my experience, I have worked with agencies that I didn't like, but I liked the recruiter. And then I've worked with some others where I didn't like the recruiter, but I really liked the agency, or vice versa. And a couple of things I look for. There is a group called NALTO, NALTO, which is the National Association of Locum Tenens Organization. it serves as a little bit of their moral ethical standard among their different agencies. And of course, when we all go to Google a locum tenens agency, there are the big ones that come up. And whether that's because of SEO searching or because they just really are that large in the market and they have such a large footprint, we're going to come across them. Those are things that, like CHG Healthcare, for example, you'll see a lot of big things like that. And they're big for good reason. They've got departments that help with your credentialing, your travel, and these are things that I kind of look for to see, are they going to be someone reliable? But the biggest thing I would say that I've seen that's you may not see this verbally written or formally written out there. When I look at a locum agency, if I'm getting called by a different recruiter every week, that tells me there's something not working well in that agency. Or if I'm getting called by a different recruiter about the same jobs, it's like, do you not communicate with other people in your group, or like what's going on? For me, when I've had a good agent, there are still some that I still keep in touch with. It's 2026, and there are some that I worked with in 2020, 2021 that I reach out to every now and then, and not even just to send my references, but just to be like, hey, how's it going? And so those relationships and the recruiters that put you in the focus are the great people to work with, and also the ones that understand what our training is. If someone comes to you, Kevin, and they're like, "Hey, do you want to go work in this pediatric clinic, or do you want to? Can you go do surgery?" Then you'd really question if they actually looked up who you were at all. And that's just the reality of how the cold calls and the recruiting goes. And I can empathize with that for the agencies, but the reality is if you're coming to me, a pediatrician, a board certified pediatrician, and all that information is out there, and you ask me if I'm going to cover at the adult jail, it's going to push me away. I've talked to over a couple dozen physicians that do locum tenens or that are interested in it, and what they don't like is getting berated by incessant phone calls. They don't like getting these new recruiters that don't understand what their specialty is or don't know who they are, and a lot of times the lack of transparency. So when I see the opposite, when I see transparency, I see it's the same recruiter coming at me. And I've had a couple times where I've had a recruiter say, listen, there's a great job here, or there is a job here, but for XYZ, I don't think it's the right one for you. So I'm not going to send you there because I'm looking out for you. Those are the people I am going to work with more. And I think it's important that everybody understands the agency's prerogative. I mean, we all do, that they are trying to also run a business, but the ones that actually keep in mind the doctor or the APP as their really important person and their priority, those are the people I work with.
We're talking to Trevor Cabrera, pediatrician and soon to be neonatologist. Today's Kevin MD article is Locum Tenens, Reclaiming Purpose, Autonomy, and Financial Freedom in Medicine. Trevor, let's end with some take home messages that you want to leave with the Kevin MD audience.
The take home messages that I would leave about locum tenens, I really put in my headline for this article is that it will give you purpose back. It will give you that autonomy, and the financial freedom are all things that we seek. The important part is to realize that there is no single linear path for medicine, and that at any time we can take a change and we can make a change, we can do something different, and there's nothing wrong with that. I have a lot of people that have doubted me, a lot of people that have not liked the idea of doing this substitute kind of work or independent contracting, but it has really been fulfilling. And I think that for any reason that you are questioning right now going into locum tenens, there's 1,000 reasons that would argue on the opposite side that you should. So whether you are at the beginning of your career, the middle of the career, or the end of the career, like I said earlier, those are all things that are made for locum tenens. So give it a try, and I think that by doing that, you'll really find ways to fight burnout, to find purpose, and to get back to the heart of why you went into medicine in the first place.
Trevor, thank you so much for sharing your story time and insight. Thanks again for coming on the show.
Thank you so much, Kevin. Appreciate it.